Hi, I am Kelly DeMarco. I am an occupational therapist. I'm a rehab manager. I'm a green team leader. I work with Wisconsin health professionals for climate action, which will soon be changing their name. And I'm a small scale farmer. I've been doing climate work for quite some time. I have been working avidly towards becoming more of a climate coach to help people navigate something as complicated and existential as climate change. And most recently, the thing that I have to add to my list of roles and responsibilities is that I'm also a partner to someone who was recently diagnosed with multiple myeloma. 1 month ago. He's 47, just turned 48. Never dreamed that this would happen so soon in our lives, nor to someone who, for all intents and purposes was extremely healthy and did all the right stuff, ate all the right foods, grew his own food, shopped at the right places. We tried to live a clean life, and you just can't know how you'll respond when something like cancer comes into your life. And my husband's version of multiple myeloma is 0.5% of all patients with multiple myeloma has the genetic markers that he has. So he's going through a really, really intensive course with chemotherapy. The first round of the clinical trial did not work for him. So now he's back admitted at Freighter, and I'm sitting in the parking garage right now as I speak with you. I can't tell you how many times in the past month we've been in and out of the hospital, multiple admissions. I've got paperwork stacking up a mile high at home, all related to this new world that we're in. And I'm reaching out to you because, life changes a lot when you have something like this come onto your plate. And the thing that I was super passionate about and spent a lot of time in prior to this was climate work. I loved my work as a green team leader. I've had to turn that responsibility over to others to manage for a while. I loved working with Wisconsin health professionals for climate action. I've had to kind of bow out of some of the meetings and set aside my co-leadership role there. And sadly, I had to kind of pass on an opportunity to pursue a fellowship that was deeply meaningful for me in the area of climate and mobilizing green teams throughout the state of Wisconsin. So, I think having been in healthcare for a long time, close to 30 years myself, and now going through this experience with my husband, it just really, makes time feel like it shrinks a lot. It also expands in ways that, I guess, to help you stand up and advocate for the things that just mean the most to you, and you learn quickly what doesn't. And so I've had to clear off everything and just spend a lot of my time outside of work and my primary roles as mother and manager, and spend time here with my husband. And interestingly enough, it's allowing me to see a side of the waste problem, the carbon emission problem that hospitals, healthcare systems emit, are one of the biggest emitters of carbon into the atmosphere. I think over 10 10% of all carbon emissions in the United States come from our healthcare organizations. And so we've got these like huge, incredibly complex systems that care for people and yet are spewing, waste into the atmosphere and into our waterways and into all kinds of things that are really like counter to the mission to help and serve people. So as a patient and as a consumer, one of the things that I've been contemplating is like, I'm so in the middle of it, and I'm, just simple things like the trays that come up to my husband's room with food have like, styrofoam and styrofoam cups and straws, and it's like a styrofoam plate with an apple on the top with plastic wrap over the top of that. And as a consumer, it like eats at me, and yet here I am, like they're trying to save my husband's life, literally. Like he's, that's really what the work is that's happening for him. And in the midst of this really hard time, I feel really conflicted because I'm like, holy cow, like these things that I care so much about, I have to just sit over here on the side because I'm here, like they're taking care of my husband and they're trying to really watch infection control and make sure that he's safe, And so everybody puts on new gloves and everybody puts on new fresh gowns, and everything that comes into his room is wrapped and secured and protected in some way from anything that could contaminate it. So like, I'm super grateful for that level of care and concern. And I'm also like super aware of how conflicted I feel around like, wow, I can't like consume these healthcare services in a way that align with my value for protecting the earth and living in harmony with the natural world and reducing my carbon footprint, because like we're so dependent upon the system. And all of the healthcare providers that come in and out of my husband's room, they're equally beholden to the system, and they're so committed to doing the right thing, and yet they don't have a choice but to produce this waste. That's just part of the job. And so I'm seeing like the role of green team leader, which is a role that I fill for my organization. And we put our heads together and we problem solve, like, well, how can we get rid of plastic? How can we reduce our waste? How can we focus on the low-hanging fruit, bigger decisions that have to do with HVAC systems and running our systems more efficiently, kind of from the top down. Those are things that require, bigger budget discussions. But the thing that I'm seeing is like, there's a lot of low-hanging fruit. Like, many of the things that come up on the tray each day that come to my husband's room several times a day and come to like the rooms of all of our patients across this whole huge system. And this is like one hospital, but there's many just for Freighter alone within Southeast Wisconsin. And I'm thinking like, wow, it would be so cool. Like if a green team were to just come together and put their heads together and like look at these things that are low hanging fruit, that could there be a different type of straw that we use? Could there be a different type of cup that we use that's more biodegradable? Like, does it really have to be wrapped in plastic wrap? Could the apple be washed when it comes to the room? I don't know. I know in my green team work in the organization that I'm a part of, we look at low-hanging fruit, we put our heads together and we try to get creative about like, what can we do to make things run differently in a way that reduces our carbon footprint. And So I've copiously taken photographs, like as I'm going through this whole journey with my husband, of like all the things that are going to go into the trash, and then they're going to go into a landfill, and then they're going to find their way into like that big bubble of trash in the middle of the ocean somewhere, or they're going to end up in the one of the area landfills that keeps filling to the point of overflowing, and they have to build more landfills, which creates a whole other issue, because nobody wants landfills in their backyard, and if you can afford it, you won't live there. But people who just don't have the resource to up and move away from the next landfill, they're going to be impacted. So how is that fair? You know, and now that's another dilemma that is like, that's health. That's the health of our community. It's the health of the people that we're here as like an organization to serve. So I'm really calling out to like all healthcare providers throughout this state of Wisconsin. Like, if health matters, the health of our environment has to matter too, because they're really not separate. And when you're thinking of like advocating for a greener, cleaner facility or healthcare institution, if you are someone who is a green team leader or wants to start a green team or wants to get involved in sustainability, like a huge talking point for you with the organization that you work with or for is, this matters to your patients. It matters so much, and your patients have to compromise their personal values and set aside their desire for clean, green, and healthy when they walk into the institution, because they don't have a choice. They have to use the styrofoam. They have to use the plastic because it's the only option that they're given. And I think as human beings, like, we can come up with better ways, and it might take, you know, it's going to take some front end work, and it might take some extra funds, but in the long run, it's going to come back to serve us as an organization. It'll serve the people that we serve, and therefore it serves us because it serves our reputation. Our patients aren't put in a position where they have to compromise their values just to receive good health care. So it's really a win-win on so many fronts. So this has just been like weighing on me over the past month as I've walked this journey with my husband. It's been weighing on me that I can't be as involved as I've been. But I still have a voice, and I'm going to use it. And this issue matters a great deal to me, and I think that there's a whole lot that can be done. And so using our voices is the first step. Letting people in our organizations know that this matters to us, and it very probably matters to the patients that we serve. Like, we can do that. And then, you know, you set up a designated time once a month, and you put your heads together with other people in the organization who care also, and you have those meaningful conversations that allow for change to begin within your organization. And that's how we tackle something like climate change. That's how we tackle something like environment and sustainability. And, you know, that's how we allow our organizations to be healthy on all the fronts. So thank you for taking the time to listen to me. I have, you know, all kinds of things to say on this, and I'll probably say a whole lot more, but for now I'll leave it at this. If you like and subscribe to my YouTube channel, YouTube at Kelly Isabelle DeMarco, you can hear more posts over time. If I can't be there marching with the people that are doing this work on all the other fronts that I'm typically involved in, I'm going to do it here, because using my voice matters to me. It's how I stay sane and healthy as I travel and partner with my husband through this unique journey that we are recently finding ourselves on. So thanks for your work. Thank you for caring. And That's it.